knock. Abigail?
Yes.
Hey, my name's Riley. I'm a student nurse practitioner at Youngstown State University. Today I'm going to be doing a health history interview on you. It's going to go for about 10 minutes. But before we get started, can you please provide me with your legal name and date of birth?
Yeah, it's Abigail Miller, 1697.
Is legal name okay, or do you have a preferred name?
You can just call me Abby.
Okay, I'm going to go ahead and Purell real quick.
Okay.
Do you need some?
Sure.
Alrighty. Alright. So you do prefer to go by Abby, you said?
Mm-hmm.
Okay. And Abby, what are your preferred pronouns?
She, her.
And then how do you identify?
Female.
Female? Okay. We're gonna get started here. Tell me, what's bringing you in today?
I was just coming in for a, general well check.
General well check? Okay. Any new complaints, issues, problems, or concerns?
Nope.
Good. And then how have you been feeling lately?
Been feeling pretty good. I'm off for the summer, so I have no complaints.
Alright, and then just to recap here, you're coming in just for a general check, correct?
Mm-hmm.
Alright, and then I just want to let you know, everything that you provide with me today is confidential. And if you see me looking down here, I'm just typing in some information to put into your chart later on, okay?
Okay.
We're going to start with your family history. Are your parents still alive?
Yeah.
Yes? So let's start over with your mother then. Does your mother have any chronic illnesses or chronic health conditions?
Yeah, so she has anxiety and depression, and then she also has endometriosis.
Anxiety, depression, and endometriosis. Okay. How about your father?
Yeah, a few years ago they told him he was pre-diabetic, but I don't think he's followed up on that at all.
Pre-diabetic. All right. We're going to move over to your maternal grandparents. Are they still alive?
Just my grandfather.
Just your grandfather? And does he have any chronic health conditions?
As far as I know, he just has, with his eyes, the macular degenerative disease, I think it's called.
Macular degenerative disease. And then you said your grandmother is no longer alive?
No, she's not.
Do you know what she passed from?
It was just complications with COPD.
Complications with COPD. And then do you know how old she was when she passed?
Probably around like 67, 68. I'm not 100% sure.
Okay, and then how about your paternal grandparents?
We don't keep in contact with them, so I don't know much about them.
Do you have any siblings?
Yeah, I have a younger sister.
And does she have any chronic health conditions?
As far as I know, just anxiety and depression.
Okay. Are you married?
Yep.
And is your spouse in good health?
Yeah, as far as I know.
Good. And then do you guys have any children?
Nope.
Okay. We're going to move on to your medical history now, okay? Do you have any medical diagnoses such as hypertension, GERD?
So I also have anxiety and depression, and then I also get migraines as well.
Okay, anxiety, depression, and migraines, correct?
Mm-hmm.
How about allergies?
I'm just allergic to penicillin, and then general seasonal allergies.
Penicillin and general seasonal. What happens with penicillin?
I get hives.
Hives. Okay. We're gonna kind of go back a little bit. Did you have any illnesses as a child that you were diagnosed with?
No, not that I can think of.
No? Okay. And then as far as you're aware, how about childhood immunizations? Are you up to date on them?
I should be, yeah.
Good. And then back to this year, did you receive your COVID and flu shot this year?
Mm-hmm.
And then how about a booster?
No, I haven't done the boosters.
No booster, okay. Do you use tobacco products?
Nope.
How about any illicit drug use, including the use of marijuana?
Nope.
Okay. Do you drink alcohol?
Occasionally.
Occasionally. How much do you think you have in a sitting?
In a sitting, probably just like 1 to 2, like whatever drink it is, glass of wine, seltzer, anything.
Okay, and then how frequently?
Probably like every other weekend.
Every other weekend?
Not that frequent.
Okay, and then do you have a religious preference?
No.
No? Okay. Tell me about your home life.
It's good. I live at home with my husband Riley and our dog Penny, and I don't have any complaints, so.
Good. Good family support at home?
Yep.
And then how does your husband treat you?
Pretty well. I have no complaints about that either, so.
Okay, good. And then do you and Riley get along well?
Mm-hmm.
Are you guys sexually active?
Yes.
Do you guys use contraceptives?
No.
And then when was your last menstrual period?
It was roughly 2 weeks ago.
2 weeks ago. Do you exercise?
Mm-hmm.
And then how many times a week?
I try to do 3 times a week.
Okay, good. And then in terms of exercise, do you do cardio, weightlifting?
I take bar and Pilates classes, so it's kind of a mixture of cardio and just like small weights and things like that.
Okay, and then do you have any issues performing simple day-to-day tasks like cooking, cleaning, getting out of bed, or bathing?
Nope.
Good. We're gonna move on to your surgical history, okay? Do you have any surgical history?
Nope, just wisdom teeth.
Wisdom teeth? All right, we're gonna move down to your range of systems. It's gonna be just a whole bunch of yes or no questions. Have you noticed any unexplained weight gain or weight loss?
Nope.
How about any fevers or chills?
No.
And then what about night sweats?
Nope.
Do you have headaches?
Just with my migraines.
With
Yeah.
your migraines? Okay. How about vision changes or ringing in the ears?
Nope.
Good. How about a cough, shortness of breath, or wheezing?
Nope.
Chest pain?
Nope.
Pain with walking?
Nope.
Palpitations?
Nope.
Or extremity swelling?
Nope.
Good. Do you have regular bowel movements?
Yeah, they're pretty normal.
Pretty normal. Would you say 1 to 2 a day?
Yeah, probably about 1 a day.
1 a day, okay. And then how about nausea, vomiting, or abdominal pain?
No.
Good. Do you have any pain or increased frequency with urination? How about foul smelling urine?
Nope.
And then flank pain, that's like pain that comes around your side? None?
No.
Good. Any problems with acne?
Yeah, I'm currently seeing a dermatologist for that.
You are seeing a dermatologist? Okay. Do they have you on any meds currently?
It's just a topical. I use azelaic acid twice a day.
Okay. How about new rashes, sores, or dry skin?
Nope.
None? Good. How about back pain?
Nope.
Neck pain?
Nope.
Joint pain or swelling? And then issues with your range of motion?
No.
Good. How about dizziness?
Nope.
Extremity weakness or tenderness?
Nope.
Okay. Kind of going back here, I know you said your last menstrual period was about 2 weeks ago.
Mm-hmm.
Would you say your periods are heavier than normal?
No, they're normal.
Normal. And then do you have any problems with bruising and bleeding?
Nope.
And have you ever had a blood clot?
No.
Good. I know you told me in your medical history you have a history of anxiety and depression. Are you seeing someone for that?
Yeah, just my primary care.
Your primary? Are you currently experiencing anxiety?
No.
Well controlled?
Yeah.
Okay. How about hallucinations or thoughts of suicide?
No.
Okay. Are you sleeping okay?
Yeah.
How many hours a night do you sleep?
It's about 8 hours.
About 8 hours? Okay. Do you feel stressed?
No.
Good. And then when you are feeling stressed, how do you cope with it?
I like to, just play video games, take my dog for a walk, play with her, work out, things like that.
Okay, good. We're gonna move down to your medications. I know you were telling me that you've got headaches and migraines. Are you on any medications for that?
So I just have a as-needed medication for when ibuprofen doesn't work. It's Maxalt.
Maxalt?
Yes.
Okay. Do you know your dose on the Maxalt?
I believe it's 5 milligrams.
5 milligrams, and then as needed, so just whenever you need it. Okay. How about medications for your anxiety and depression?
Yeah, so I take Zoloft daily. That's 25 milligrams. And then I also have Xanax for as needed, and that's 0.25 milligrams.
0.25 milligrams, and then do you know your when you take your Zoloft, is it in the morning or at night?
I usually take it at night.
At night. All right, and then you were telling me you see a dermatologist and they've got you on azelaic acid, correct? And then do you do that once a day, once at night?
I do it twice a day, so in the morning and then before bed.
Twice a night, or twice a day, I'm sorry. And then what's your highest level of education completed?
So I have my psychology specialist degree, so it's kind of like in between a master's and a PhD.
Okay, good. Are you employed?
Yep, so I'm a school psychologist at Cloverleaf Schools.
Good. And then about how many hours a week do you work?
It's usually about 40.
About 40 hours a week, okay. And then how do you feel about your current level of health?
Pretty good.
Pretty good. And then what do you like to do in your free time? I know, working in the schools can be a pretty, stressful job.
Yeah, so, I have the summer off, so that's been good, but I pretty much do the same things that I mentioned when I'm stressed. Just, play video games, hang out with my dog, hang out with my husband, just things like that.
Okay, yeah, summers off is a pretty good part of working in the schools. So I have concluded this. I've got everything that I need. I would just really want to thank you for your time today. Do you have any questions for me before we finish up this session?
No?
Good, okay. It was a pleasure meeting you.
You too.
If you have any questions, you can give me a call, okay?
Okay.
All right, thank you.